to use my hotspot. Okay, there we go.
There
We
you
are
go.
live. We live. We live. We live. We
All
live.
right.
All right. Hello, everyone. Good afternoon, good evening, good morning, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolo Livingspring, CEO, co-founder of Livingspring Family Medical Center, where we help our patients live long and well because we believe the quality of life is just as important as the quantity of life. As always, really, really excited to have you all here on this beautiful day discussing topics that help us, improve our quality of life. If you're watching live, hashtag live. If you're watching replay, hashtag replay. And today we're doing something a little bit different. We're having a series where we have perspectives from patients with some of the diseases we talk about some of the ways that they've overcome their medical conditions. And I'm excited and thankful and honored and delighted and all the things to have Mr. James Wallace here. How are you doing this evening, sir?
I'm doing great. How are you doing, Dr. Doing great.
I'm doing well. Thank you. Thank you for agreeing to do this. First, I'm going to ask you, why did you agree to do this?
Well, I just wanted to kind of get the word out there about type 2 diabetes and how serious it is, because I feel like not enough diabetes patients take it seriously enough. That's just how I feel. And that's kind of why I want to do this.
Okay. Also, because I was like, hey, you want to come share what you've done, that has worked? And you were like, yeah, sure. And I'm like, okay, that's cool. All right. So let's talk about type 2 diabetes. Like, tell me a little bit about your personal journey with diabetes. When were you diagnosed, or when did you decide that, what did it for you as far as deciding that you want to reverse it? You don't want to have to take medications for it. And so you were going to fight the disease. So talk to us about your journey when it comes to diabetes.
This came about about 6 months ago.
Okay.
And even though I've been on this journey for about 2 years,
Okay.
trying to reverse. And I was struggling so bad with it because I couldn't understand it. I was changing my eating habits, and I couldn't figure out why I couldn't get my numbers down like I should. And it was just so confusing to me. So I just started doing a lot of research, and I just, I think I was eating the right foods. I was overeating the foods that I was supposed to eat. I was overeating, and that was causing my numbers to stay up. And I couldn't realize that until one day I just, I think I don't need 3 pieces of chicken, maybe one, 1.5, not a whole lot of broccoli, maybe half a tablespoon of broccoli and a cauliflower, whatever. And
broccoli is good for you now.
Yeah, it is. I mean, I like I said, I was overeating everything, and that was still kind of causing my numbers to stay up a little bit. They just wasn't falling where I wanted them to.
Okay. And were you tracking your sugars? Is that what you were doing?
I was tracking them every day. My numbers didn't turn around until April 22nd. That's when I really started hitting it hard. And I went on a 90-day spurt where my average numbers for them 90 days was 106 for the whole 90 days.
Okay. So biggest tip here and what you're sharing, it is good to kind of see what the foods are doing when you eat. Now, I'll be honest with you, and sometimes this is hard, especially if you don't have really bad diabetes or your sugar levels are not low enough. Insurance may not cover the glucometer. So you can, not the glucometer or the continuous glucose monitoring. So you could do the finger stick where you check your sugars morning, maybe 2 hours after a meal, but they have the continuous glucose monitors. And those are ideal because you can see in real time what you eat, how the sugar goes up, how it goes down, and you can adjust. It's such a good real-time data, but insurance usually doesn't cover it unless you have, like I said, low glucose episodes or really bad sugar levels. So it may be worth, I really think it's worth investing in one for yourself because you can make changes yourself.
Yeah. Right. I mean, I check my sugars every morning, the first stick of the day, and I take that first stick of the day, them first numbers, whatever the number is, I go off there for the rest of the day.
Okay.
So if it's in range, then I need to keep that in range for the rest of the day. So I just take that first stick and I just go from there. And that's how I kind of judge on what I eat.
Okay. And the beautiful thing of the continuous glucose monitor is you can see, and it's almost like a game. Ooh, what can I eat and still be full and feel good?
Yes.
To keep my
Yes.
sugars in between. Like it's like a
Yeah.
game where you're tracking and you're keeping it within
Yeah.
the
It is.
number.
Yes.
So it's good. Now I will say also this. Sometimes people get freaked out, like, oh, I just ate, my sugars went up. It's normal for it to go up when you eat. It's just you shouldn't stay up at least 2
Yeah.
hours after you eat. So don't get freaked out. But of course, these are, have a conversation with your doctor, to find out the right fit for you. Because some people need higher numbers than others. So anyway, that's a discussion for a different day. My next question to you, Mr. Wallace, is what was the most challenging part of starting your diabetes reversal journey? Because you make it sound easy. Like, yeah, I just cut it down. I ate less and, problem solved. But what were some of the challenges you had in trying to maintain sugar levels that would be good or best for you?
My biggest challenges for me was staying off the foods that I was normally always eat. And in the beginning, it was so hard to leave off the pizza, the hamburgers, the hot dogs, the sweets. And it was so hard for me, but I kind of wheeled myself off of it and I just got to a point where I didn't need it no more. I didn't need the sweets. I didn't need the hamburgers. I didn't need the pizza. And once I realized I didn't need all that, and it was other stuff to eat, because it's always other stuff to eat. And that's what I realized, it's other stuff to eat besides the stuff I've been eating over the last 40 years, and that really strained me along. And I was just like, I got to get this, and I did it, and now pizza, I don't give it a second thought. Hamburgers, when I do want a hamburger, you know what I do? I give it out the bread. Eat it with lettuce, put my regular toppings on it and eat it like that, and that was the biggest part for me, just trying to get away from the foods, and I did that. And even right now, I don't even give it a second thought no more. I just don't. I know it's not easy, because it's not easy, because a lot of people can't really give up their food and they don't really want to, but I just felt like, you know what? I gotta do something. I gotta do something different. This medication was too high. So you just don't know how much money I'm saving now, not taking the medication no more.
So it was a money saving thing for you.
Yes.
Okay. That's fair. That's fair. Now, for someone who's watching, they're like, Thanksgiving is around the corner, right?
Right around the corner.
So how do you stay motivated, or how do you plan to stay motivated? Now, Halloween, for those who celebrate, it's gonna be a lot of candy.
Yeah.
So,
because I don't eat sweets no more. I don't eat sweets anymore. And believe me or not, when I first started this journey 2 years ago, I started in November, a week before Thanksgiving. Week before Thanksgiving 2022. I haven't had a turkey dressing, sweet potatoes, all the stuff that you really don't need on your plate, biscuits. Why would you eat biscuits and dressing at the same time? That's double the carbs. So now during the holidays, I just eat greens and meat. I don't eat the dressing, the bread, the potatoes, and I don't eat none of that. I haven't had dressing in over 2 years. This coming November probably be 3 years where I haven't had dressing, regular dressing, Christmas dressing, and Thanksgiving.
So how now? So is this like you the one who's doing the things, or is your whole family doing this with you? Because I can imagine that this is not easy if you don't eat it.
It's not, because my wife, and I love her there, she's right there with me. And that's another thing, a support system. If you don't have a support system around you that's helping you and working with you and doing it with you, this probably not going to work. So I give praises to my wife. She's wonderful. She helped me to do this whole thing. She was a diabetic, and she reversed her diabetes like 3 years ago, and she been off her medication, probably going on like 4 years. So she was a diabetic too. So she was another one of my inspirations that I went off of, and just, you know, we could start doing things different, and eating together and just doing things different. And yes, support system is a big deal.
Support system. I like it. So we're talking tracking your sugars as a way to kind of keep yourself in the game, right? You track your
Yes,
sugars,
yes,
you know, foods keep you within number range. So that's one. We talked about having a support system. We talked about realizing that the other foods you can eat, you have options. So
that's
like
right.
other things. And you found ways to adjust your burgers and adjust your sandwiches to other things that can substitute or removing the things that tend to shoot your sugars up. I gotta say powerful. Now, and then you also mentioned that saving money too was a it was a deal for you. Now, what about exercise? Was this all diet based, or did you exercise at all? Are you active, or you just
Well, in the beginning, I didn't exercise because I dropped my carbohydrates down so low because I wasn't eating anymore, and I wasn't exercising. But I know it's still good to exercise, and I got a treadmill that I jump on once or twice a week. But I'm really not that active. Exercise, I know I should be, but
okay?
it's not a. It's not a. I guess I'm gonna say it's not a. For me, it's not a big priority because I done cut way back on the stuff that I know I shouldn't be eating, and that's kind of hipping me a little bit. That's kind of, I guess, how I see it in my mind. But I'm not a big exercise guy, so I'm not really active like that. Maybe once or twice a week.
So you do the treadmill. Now, from the
Mhm.
day to day, do you mind sharing what kind of job you do? I want to see how your activity level, because sometimes people feel exercises, you got to go to
Yeah,
the gym.
yeah.
Or
Well,
but talk to me
yeah.
about what you do on a regular.
Well, I work at Oak Farms Dairy. That's a milk plant. I've been there
Okay.
for this February to be 29 years, and I'm an inventory control clerk. So majority of the time I'm sitting behind the desk, and then a lot of times I'm out on the floor counting
Okay.
milk, making sure the inventory is right. So I don't sit down all day because I'm always sitting down. I'm sitting down 20 minutes at a time.
Okay.
I go on the floor, count what I need to count, come back up, and then do something else and do the same thing. Although, so I'm not totally sitting down all day, but I'm just a little bit sitting down all day. But I'm kind of going all day. I'm walking. I mean, because I think I do like 10,000 steps a day, and that's just working in the office and working on the floor. So I'm kind of doing both of them.
Okay. So you are active. 10,000 steps a day is
Yes.
actually good. You just don't see it as time you set apart. So the
Yeah.
encouragement here is no, you don't have to have a gym membership. You can try to work on their time. So when you're at work on your boss's time, man. Get your exercise in on
Yeah.
their time. Save you
Yeah.
some time too. Okay. So that's big. My next question for you and thank you so much for sharing this. I appreciate you.
Hmm.
What other benefits have you noticed since you were able to do this? Like, are there other bonuses that you noticed since you've reversed this?
One thing I have noticed when I started, I was 255 pounds, and I'm
Hmm.
5'4", and that's kind of heavy for a guy that height. Once I got off all of the carbohydrates and just got off of them, my weight just shot down, and I didn't even exercise. I'm not trying to encourage not exercising, but because I cut out all the carbohydrates and cut all the bad foods out of my diet, my weight went from 155 down to like now it's in a range of between 137 and 140 now. You know, most people may say, well, that's not a lot, 155. Well, I mean, for my size, I shouldn't be
That's a
155 at my height. I should be around the height that I should be, which is between 137 and 140. And I'm hovering every day between 137 and 139. And because I check my weight every morning. Every morning I have to check my weight. So I mean, to have that drop off like that and to see it, and just cutting out the foods that make you gain weight, and I cut them foods out of my diet. That's the biggest bonus right there. is the weight loss.
Okay. All right. So for someone who's watching, who's like, whew, they just got the diagnosis of diabetes. They've been asked to take 4 medications. And now we're not saying don't take your medicine. Please, of course, these are medical suggestions. Make sure you see your doctor. But they're feeling overwhelmed and they feel stuck. Like this was something they didn't want to do or get to. They've seen their family struggle with the consequences of diabetes. I've seen people, when I tell them they're pre-diabetic or diabetic, like have this look of doom, thinking that it's a death sentence. But what would you say to encourage that person who's just starting their journey, who's like, I'm taking the medicines, but I really want to reverse this and I want to get off meds? Any advice you have for them?
My main advice is, if you have to take your medicine, please just eat like you're supposed to eat. Eat like your doctors tell you you're supposed to eat. Do your research. If you're eating right and your doctor's seeing your numbers go down, eventually your doctor is going to tell you that your numbers are great. We might not take you off a medication or 2 because your numbers are so great. That's the whole key. Is if you take your medication, you still have to eat right. Because if you don't eat right, then all this is, to me, is for nothing. So it's the reason why they say you got to take the medication, but you have to eat right too. So if you eat right, eventually that medication is going to come off, and just stick with it, and it'll come. I mean, it'll come. It was time for when I wanted to just get the whole thing up because I didn't see no results. But because I stayed on my plan and got off the foods that I need to stay off of, one day I woke up, checked my numbers. I think it was like under 100. And I think I went like a week in a row, 5-6 days in a row with my numbers in the 90s. I knew then I turned the corner. And my numbers been low ever since. This has been low ever since. And I still to this day, I eat right. That's the biggest encouragement that I give. Just stick with the plan, and you will come off that medicine, and your doctor will take you off of it because they're gonna see your numbers as low. There's no need to be on medication if your numbers is where they're supposed to be at.
And the beautiful thing too is, I, as a physician, when I see you and the numbers is good, there's a dance. It's like our goal is not to keep you on
all the time.
The dance, like, yeah, that's right. The numbers are better. Let's see what medicine we can get you off. So the encouragement, even if you're taking medicine, please do the things. But I have someone who's watching who's like, how do you stay motivated? Like, how do you stay motivated?
Ooh.
Because some days are hard.
You know what, that questionnaire is, how do you stay motivated? I just look within myself, man. I just had to, what made me stay motivated is the people that I knew that was diabetics around me and was losing limbs from amputations because the diabetes is out of control. And I just said, you know what, I don't want to be that guy. I don't want to lose my life to that. I just want to do something different, and that's my biggest motivation to just not, because I seen too many people pass away from that, throughout my life, and I got a family of diabetes, and I don't want to be like that. I just want to do something. I want to live different. I want to just live a better life, and I don't want diabetes to take me out. I know I can't live forever, but I just don't want diabetes to take me out. Not like that. With something I know that I can control. I can control this, and that's my biggest motivation right there. Just seeing the people around me just fall off because of it.
Awesome. Thank you for sharing that. And we have a choice. You have a choice. Seeing your family history. You're not your family, right?
Right.
Everyone's path is different. We can make decisions based on what we see. The things and the power in our control, the things we have the power to control, we do our part. and we keep the vision ahead of us. You're looking forward to something. You're looking forward to enjoying your
Yes.
retirement and enjoying your later years. And your later years can be your best years. So thank you for the encouragement. My last
Yes.
question, how important is support from your healthcare professional, family, and friends? And I'm asking this, for people who are watching who are like,
Yeah.
I don't know, man. Like, whenever I try to talk about getting off medicine from my doctor, and they're like,
Yeah.
like, what would you say?
My starting with the healthcare profession. If you don't have that doctor in your corner to want to help you live a better way of life and not trying to help you, if your I don't care what nobody says, if your doctor's not good, then you're not going to be good. It all comes down to your doctor. And I got a wonderful doctor, Dr. O. I throw that in there. But you got to have a good doctor support system. Family, you got to have a good family support system. I have one. My wife, my kids. I have gotten so good with my diabetes that my kids is picking up on what I do now. They start not to go eat out as much. Start sitting down at the dinner table and eating a healthy dinner. My son, he doing the same thing. My wife, like I said, she's wonderful at coming up with ways to cook a nice low carb meal, and I'm loving it. And I just whatever she cooked and it's low carbs, I'm eating it. You know what I'm saying? Because I know it's not going to affect me. But without that support system, you can say you can do it by yourself, but it's hard to do it by yourself. You got to have a good doctor, family support system. And if you don't have that, it's going to be hard for you to move forward. You're going to be up and down with it all the time.
Okay. That's powerful. And for someone who's watching, who's like, well, good for you. You got the good wife, you got the good kids who listen to you. Good for you. I want to encourage you. Sometimes you gotta show it more than you tell it.
Yes.
So show it, because you mentioned something. You said now your kids, and you've been doing this for 2 years, so you've been in there for a minute, right? So you said your kids are watching you. So sometimes, of course, we want our family members to just jump on and get all the eating healthy. Sometimes it's hard. Everyone has their own journey, but as you do it, they can pick up habits from you as well,
Right.
and do the same thing. I'll be honest with you. When I eat salads without dressing. I've been doing that for almost 10 years now. I eat dressing my salad. I'm used to it. Why? Because I have a mother who, that's normal for her. She would reward me with fruits and vegetables. I was like, good job here. She wouldn't give me candy. She wouldn't give me cookies. It was so now I'm doing the same thing for my kids. So it's almost second nature. They snack on apples. Now, of course, they see like the sweets and stuff like that. But over time, you pick up good habits that make for a better future for yourself and the future to come. So our encouragement here today, and thank you so much, Mr. James, for coming, is don't give up the fight. Doesn't matter the diagnosis. Please, there's hope. Don't give up the fight. Do research, he said. Ask questions. And go back to your doctor and even advocate. You don't have to see me. I love you, see me. You don't have to, but you see someone. Advocate for yourself. He was very clear. I don't want medicine, doc. He made it very clear. I do not want. I said, okay, we'll do this. You do this. You do this. Let's give it this amount of time. We'll repeat. And it was like a challenge. And he pulled through. And the truth is, if we maintain a normal A1C, there's certain ranges. If it's good for a year, we can take out the diagnosis of diabetes. Go on. So please don't give up the fight when it comes to this and everything else, when it comes to your mental health space, when it comes to high blood pressure, high cholesterol. Please do not give up. Do research. Find a team that will advocate for you on your journey to wellness. Okay.
Yes.
All right.
Yes.
James, man, you rock, man. You rock.
Thank you.
Oh my goodness, it was so good having you. Thank you so much for coming.
It was good. It was nice being here. Thank you for having me.
Oh, my pleasure. And I may have you again. We'll like to see how you're doing maybe next year.
Okay.
And give us tips on how you survive the holidays, because that's
Hey, I'm going on my third holiday.
Okay. So it'll be good. It'll be good to know. So thank you so
Yeah.
much for sharing with us, and
No,
thank you
thank
all
you.
for watching live replay. If you know someone who could use this encouragement, please forward this video to them, and don't forget to subscribe. That way, you get alerts when we have these talks. And one more thing: if there are topics you want me to talk about, you want me to bring someone on with real life experiences, send a message. Let me know, and we could have it put together maybe in the new year. And as always, if you or anyone you know is looking for an awesome, a thorough, and compassionate family physician in the Mansfield, Texas area, who will have conversations like this to help you live long and well, I am she. Have a good one. Thank you so much.
Thank you. Bye-bye.
Bye, everyone.
Bye.
All right, Mr. James. Hang on one second.
Okay.
Let me see.